Well, thanks for coming on this kind of beautiful but rainy day. And I'm going to talk today about infants who are at high risk for autism, and I'll explain more about that as we go along. And some of the innovations that are coming out of these research projects in early identification of autism. And this study, as you'll come to understand, is very complicated, and it wouldn't be possible for me to present what I'm presenting tonight without the help of a lot of people. But in particular, I want to call out Stephen Dager, who's the co-principal investigator at this site, Lonnie Zwagenbaum, who's in Canada, Joseph Piven, who's the director of the network study at UNC, and the whole infant brain imaging study network. So first, let me tell you just a little bit about what an autism spectrum disorder is. I'm going to go really fast through this. This could be a whole hour-long talk in and of itself. But basically, the DSM-4 is our current, almost outdated, but still current diagnostic manual that helps us understand disabilities and psychiatric disorders. Autism falls under the umbrella of the pervasive developmental disorders, and some of the specific disorders underneath that larger category are autistic disorder, Asperger's disorder, pervasive developmental disorder, not otherwise specified, and childhood disintegrative disorder. So there's, if you hear any of these terms, that's all part of the same thing that in the new DSM, see at the bottom of the DSM-5, we're going to call autism spectrum disorders. So all of this will shift and change a little bit in the coming years, but essentially autism spectrum disorder is going to now sort of subsume all those different categories. And the core impairment that we think of associated with the autism spectrum is still the same. So that is social and communication impairments. And so, is this okay? This mic is kind of odd.
It's still like it's going in and out.
Yeah, but I don't want to. Is it okay if I do something different with the mic, or will that be a problem? It will be a problem. Sorry. No problem. Okay. So the autism spectrum is kind of defined by impairments in the social domain, and that can kind of range anywhere from people who are really avoidant of social interaction and find it almost distressing, to people who are really interested in social interaction but just have a very difficult time sort of naturally learning social skills or responding in typical ways to social information and environment. Communication now is being lumped in with social interaction because really it's hard to disentangle those two, because communication is such an inherently social act. But people on the autism spectrum, again, range in their level of impairment. Some people never learn to speak, don't obtain functional communication, whereas other people on the autism spectrum have very, even advanced language skills in some ways, but their social use of language is the thing that's impaired. So they may interrupt in conversations or not really respond when they're being spoken to, that kind of thing. And then the third domain in the old DSM and the second domain in the new DSM is restricted and repetitive interests and behaviors. So this is a domain that, again, varies tremendously from individual to individual. It can be things like motor movements or stereotypic things like hand flapping or rocking back and forth. And it can range all the way from something like that to a specific kind of unusual interest, like an interest in trains or some kind of parts of an object rather than playing with an object. Okay, so autism spectrum disorders, this is the last sort of background slide, now are thought to affect up to 1 in 80 children and people. And this is a new report out of the center of the CDC, which is a national center for disease reporting. And this, as you probably all know, we could also have a really long talk on that. No? Is that distracting people? This is very loud. It's not my heart rate, really. It sounds like it is. Really, it's not.
You're talking about repetitive
leave, and it's doing this thing in the background. So.
I just called CIS. They're on their way.
Okay.
Thank you.
But is there anything I can do?
I wonder if you could try the handheld mic, maybe? Do you want to try the other one?
Sure.
Would that be okay?
Yeah.
Yeah.
If you want to turn it off on the...
Yeah, turn that one off, the one that you're...
Ooh, this might be better. Is that better?
Yeah.
Ah, what a relief. Okay. All right, thank you for that. Okay, so then the sex ratio, there's more males than females. And seizures are common in people with autism, relatively common. And interestingly, the onset tends to be in adolescence for people with autism. And then the onset of symptoms is very early, prior to 3 years of age, and that's where I'm going to spend most of my time today talking about. And the last point I wanted to make is that intellectual disability is also very common and co-occurs with autism spectrum disorders. Up to 70% of people with autism, and some studies are thought to have intellectual disabilities, but some studies show a lot lower proportion, and perhaps with our expanding diagnosis and sensitivity to these disorders, the lower estimates are more accurate. So that's, in a nutshell, what autism is. That was really fast. The other thing I wanted to tell you, though, is just one slide about what we're thinking causes autism spectrum disorders. So the causes we think are really complicated, that it arises from an interaction over the course of very early development between a number of factors. The first factor is genes. So genetics play a very important role in autism. It's probably the most highly genetic of any of the developmental disorders, other than the single gene disorders, such as Down syndrome, that we know are caused by a particular gene. So it's caused by genes that then give rise to differences in brain structures, that then we think give rise to differences in brain function, and very early environment. This is really thought mostly to be prenatal environment. Yes. Okay, so the prenatal environment may then lead in conjunction with genes and brain function and brain structure to very early behavioral deficits that in and of themselves may then feed back, now we understand, to impact things like gene expression, which then impacts the whole system. So it's a really complicated story, but very much neurobiological. And what I'm going to argue tonight is that to understand the causes of autism spectrum disorders requires studying very young children. And we'll see if by the end of this you think I'm right about that. The first slide I wanted to talk to you about is a slide that is based on work by Steve Dager and our research group that was conducted quite a number of years ago now. I guess this might have been published, 2002. You can't quite see it down there. But it was published in 2002, and what it showed is that children with autism, who are in yellow on the left, there we go. That children with autism have larger volumes in cerebral volume, this is, compared to children with typical development and children with developmental delay without autism. And this was a really important finding. It actually has been replicated now in a number of different research groups with different children. These are all children, by the way, aged 3 to 4 years of age. And the way we found this out was, and Dr. Dager's team found it out, was by looking at the brain using an MRI, so magnetic resonance imaging. And this was something that people hadn't done before, so it was very innovative. And now there's a number of groups doing this. There's not a lot of things in autism research that replicate. So as those of you who are studying scientific disciplines know, that replication is really important. You have to be able to do a study and then do it again and find the same results to believe it. In autism, that doesn't happen very often because it's such a complex disorder. But in terms of this enlarged brain volume, it really has happened. And actually, this slide is not a single study. Each dot represents a separate research study. And what this shows, this was done by Eric Crochane in 2005, was age in years across the bottom, so starting at 0 years of age, 5, 10, 15 years. And this is sort of like cerebral volume. Essentially, this is normal. So this is a z-score for those of you that like statistics. But a 0 means this is the normal size of your brain for that age group. And what these different studies have shown, so there are 2 studies that were done with children very, very early. Those showed that these kids had brain volumes lower than average, lower than you would expect. And then as these studies have older and older people in them, you can see that at around age 3, these brain volumes are highly increased compared to normal. And then over time, as people get older who have autism, their brain volume kind of normalizes. So there's this really big increase in brain volume that happens sometime between birth and about age 3 to 4. And so one of the things that we're trying to do now is understand what's going on at that time in the brain, but also what's going on behaviorally. Because here's the thing. The average age of diagnosis for autism spectrum disorders in the United States is 3 to 4 years of age. And one of the things that kind of jumped out early on was, that's interesting. That's around the same age that this cerebral volume increase is peaking. And it's, you never know what causes what, but it seemed probably not to be by chance that was occurring. So that kind of set the stage for a lot of research that's going on right now. And one of the things I want to tell you, I don't know how many people here are studying in the sort of psychology type disciplines, but don't worry. Despite everything we're learning about genes and the brain and autism, it's still behavior that defines the disorder. So you all will, that we really need psychologists and people in those kind of professions still, because really how we know somebody has autism is asking parents to talk about their child and their early behavior socially, communication-wise, and their repetitive interests. We also rely on clinical observation. So people who have training in working with children are needed to be able to observe directly social communication and repetitive behaviors in children or older people. And then we also use standardized testing. So we also, want to get a picture of somebody who's functioning across a range of different areas, not just the symptoms of autism. So we want to understand if they have a developmental disability, intellectual disability, other kinds of learning needs. And all of this, though, I would say, is leading us to try to understand more about what is happening before age 3 to 4. So if most kids are coming to our attention at age 3 to 4, we kind of know that something must be going on before that time. And so there's currently a lot of controversy related to the timing of autism symptom emergence and the onset pattern. So what does autism look like as it's sort of becoming clear to people that something's going on? And what I'm going to show you, this is what I mean about things not replicating in autism and there being a lot of heterogeneity. So here are some of the different onset patterns that people have reported so far in the literature. Some children show early signs. So as early as 8 months of age, maybe even earlier, people can tell that something is, not only something is wrong, but that it seems to be on the autism spectrum. And however, in this really early age group, so 8 to 18 months, to make things harder, some children who show early signs won't go on to develop autism later. So they look like they might be on that sort of developmental trajectory, but then when you continue to follow them over time, they might end up with a speech disorder or anxiety disorder, but they don't end up with autism. So some people who go on to develop autism actually show no signs at 12 months of age, but they have what's called a developmental regression, where they look like they're developing typically, and then at average age around 19 months, they really lose skills that they seemed to have had before. So if they're starting to say first words, they stop saying those words, or if they're sort of interacting and smiling and socially engaging with people, that kind of drops off around that age. And then there's another onset pattern that's been observed, which is kind of initially mild symptoms that gradually increase over time and maybe don't become really clear until after 2 years of age. So there's a lot of different ways that autism starts early on. But one thing that we have found in research, so it's not all unclear, at this point it does look like between 12 and 24 months there are some early signs that many children who go on to develop autism do show. And this is convincing evidence because it comes from various lines of research. So retrospective reports is one way that we can find out about this. So you talk to a parent or a caregiver or a doctor's look at doctor's records for kids you know have autism, and you ask, what were they like when they were 6 months? Or you look at their medical record to see what the doctor was reporting. Those are retrospective reports. There's also home video studies. So this was a big deal probably when Bev and I were kind of in graduate school, right? That videos were just starting to be kind of common in people's households. And so what some clever researchers did, including people here, Julie Osterling and Geraldine Dawson, they had parents who had children who had been diagnosed with autism. They said, did you take videos at their first birthday? And so you can imagine first birthday parties are all have some common situations. So there's a baby, usually surrounded by smiling, singing people that is presented with a flaming birthday cake. And that happens over and over on all these videos. And you can look and see what the baby does in that situation. Do they look at the people or do they look at the cake? So really, do they vocalize? What are their reactions like? And it turns out you can start to see some of the early signs of autism in that situation. There's another way of looking at this, which is something I'm going to talk a lot about, prospective high-risk infant sibling studies. That's a lot of words, but basically what that is looking at infants who have older siblings with autism before they show signs of autism. So you start when the babies are pre-symptomatic, and then you follow them over time, and I'll talk more about that. And we know these babies are at risk for autism, so I'll tell you more about that. And then there's also clinical samples. So we right now have studies where we're recruiting children 12 to 24 months of age for intervention studies. And so there are, now we have this really increasingly aware community of parents and practitioners who all are starting to notice these early signs of autism, and then they refer them to specialized clinics, so maybe our clinic or other clinics, and then we can see whether or not we think that baby has autism. And those, there are infants who do sort of develop clear enough signs early on that we can diagnose some kids at that age. So, but one thing to keep in mind is over time, by age about 36 months, the stability of autism diagnosis and the clarity of the symptoms just increases over time. So there are relatively few kids who at 12 months you're really certain about, and more kids over time. So, the three big categories are really the categories that we look at during this 12 to 24-month period of time. So the social domain, what you see in infants is less social orienting. So you see less initiating social interaction, so less sort of starting off interaction, less sustained engagement. So even if the baby initiates social interaction, it's not going to last that long necessarily, and less coordinated interaction. So less of that give and take that we think of as characterizing social interaction. And I want to I put less sort of repetitively there because I wanted to emphasize it's not black or white at these early ages. Later on, sometimes you see much more clear signs, but early on, sometimes a baby will orient, but just not as much as you would expect, or they will interact socially, but just not for as long as you would expect a typically developing baby to do. In the communication domain at this age, at 12 months, not a lot of babies are doing what we would think of as verbal communication anyway, but they do use gestures to communicate and get their point across, and babies who go on to develop autism are doing that less frequently. And some babies during this time will also have delayed milestones, so they won't get their first words at the same time as typically developing kids. And then in terms of repetitive behavior, things get really interesting. Right now, well, I would say that a couple years ago, I would have told you that isn't a distinguishing factor at this age. But now there's beginning to be some research using these prospective studies where people are looking really carefully, coding very subtle repetitive behavior, and they are seeing that babies at this age are spending more time looking at toys, kind of visually inspecting them in slightly odd ways. It's very quick, it's pretty subtle, but it is statistically anyway distinguishing babies who go on to develop autism from those who don't. So I think what I'll do now, I'll quickly tell you this. So despite how unclear it is at 12 months, we're actually trying to look even earlier than that and try to see what might be going on before that time. Because the idea is, well, does it just start at 12 months of age, or are there subtle signs even earlier that we can detect? It's much less consistent. The research is really about to explode, I would say. There's lots of studies going on now. But the first few studies really that were published really led people to believe that there was not much in terms of overt behavior that we could see before 12 months. So these early studies found that there were no social or cognitive or motor differences, for example, at 6 months of age. But a little more recently, there were some hints that maybe there were some things that we could see early on. So for example, motor development seemed like it might be delayed in kids that went on to develop autism. Temperament seemed to be a little bit difficult in kids who went on to develop autism. Some eye tracking studies showed that where babies were looking was different than if they went on to develop autism. And ERP, so that's brain kind of measures of brain electrical activity were different in kids that went on to develop autism in some early studies. But then just a couple months ago, a new study came out, which is a population-based study in the UK that did actually find differences at as early as 6 months. So I think we're going to start, now that we're sort of knowing where to look, we may start seeing more. I think I might skip this part. I just want to say that all these findings, I guess I'll just quickly say that these findings are variable in part because there's not that many studies, but also in part because each of them use different strategies for getting the children together who are in the study. So some of these studies are population-based, so they look at the whole population of a certain area and then try to figure out what's going on in the population. Other studies use clinical populations, so some of those retrospective studies are using kids who already have autism and then looking backwards. That sort of gives you a different slice of the pie. And then we have these prospective high-risk infant studies. And this is kind of a different group than kids who have already had autism and then you're looking backwards. One thing we know now about the prospective infants from these studies is that about 20% of infants who have older siblings with autism will themselves go on to develop autism. So that's much higher than the population risk. And one of the other things we find in these kind of studies, when you're looking at infants really carefully over time, you're going to see more mild cases, so kids that maybe wouldn't come to the attention of a clinic, or at least not for autism, or at least not that young, and more subtle symptoms. So you're going to see things that, kind of come out in the wash in a way if you're not really looking carefully. There also is a subgroup of these infants who have older sibs who do have these early signs and then go on to kind of develop okay. I mean, they might have some little unusual things, but nothing that you would call a disorder. So they have sort of a different developmental trajectory maybe than other populations. So that's something to keep in mind. So what I wanted to do now is show you this. So I've talked to you about it, but now let's take a minute and actually see what this might look like. And so this is a little girl who is a high-risk infant sib, and she's in our study that we're doing right now that I promise I will tell you about in a minute. And this is her at 6 months of age. And and then I'll show you her at 12 months of age and then at 24 months. And so what I want you to look at think about those different bullet points that I kind of went over a minute ago. So think about her motor development, think about her temperament, think about social and communication skills that she's showing at these different ages. And see what you think here.
The banging down that.
Oh yeah.
So one thing I'd say here to look at is her motor. It's very subtle and it's not, it's just that she's not really able to hold her head up very well and control her body maybe quite as well as some other
hanging things, which she loves. Makes music, and she's got one of those jumperoos. They put her in and they jump. Okay,
So you see she just peeked up at the examiner, so it's not that she's completely, you know, non-socially oriented. She's interested in the toy too.
No, they made it a little bit darker, but that's what she came out with. I was surprised. I didn't expect to get a blue-eyed child.
Really?
So lots of babies at this age. So that is very typical. But here, now she's playing peekaboo. Peekaboo, there she is. There's Peekaboo, there she is. See a little smile. There's Cassina. Peekaboo, there she is. So there she is. Oh, this is cute. Peekaboo. So a little subdued, you know, maybe not quite as reciprocal as you might think, but she's really, it's nothing that you would think, oh, this is really concerning, right? What are you doing? Now she's 12 months old. And I would just point out this little quick thing she just did of picking up the little pig and looking at it is something that people are now finding might be related to kids who go on to develop autism. This is not a very obvious kind of repetitive interest, but that's the kind of thing that we're seeing now. Also at 12 months, you're really thinking you're going to hear a lot more vocalization, even first words for some kids. And notice how quiet she is. See the book? Who's that? But she did point, which is a big deal. She doesn't really coordinate that with eye contact though, or affect. She's not sort of smiling or sharing enjoyment. But it's again, this is not something that you would be really worried about probably. Maybe her vocalizations. She's really quiet right now.
Unusual too that she's sort of got the rattle in the other hand, that there's no sort of coordinated bilateral movement trying to play with the book.
Yeah, I don't know if that's unusual or not. Yeah. Babies are so, that some things about babies aren't predictive of later development, and some things are. So I don't know for her. But you can see she's just more frequently looking at the toy and less frequently looking at the examiner. And it's a really good example of not a complete lack of social interaction, but just not enough. Puppy dog? There's a little noise. Now we're going to see a little peekaboo. See a little bit here. So she does reach, so that shows that she's doing a little anticipating of the social interaction, and now she's initiating it, right? That's really cute. Peekaboo, there she is. So again, now then she kind of goes back to her own thing. And now here she's at 20 months.
It's like, there's cool stuff in here. I know, I see that's wrong.
And this is kind of sad to me, although she's doing great now, I have to say. but it was really hard when she came in at 24 months. She's, the examiner now is trying to see if she can get her to imitate with the frog. If those of you who know the ADOS, she's doing the ADOS. And instead of imitating, she ends up just really examining the frog. It's not very loud, is it? Sorry. That's okay. Well, you know what? It doesn't, that's okay because she doesn't really say anything.
Okay. I'll see here.
But yeah, that's okay. So she's saying, zoom, 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 you do it. And then she takes it, and instead of imitating or playing with it, she starts examining the toy again. And kind of looking at the specific little parts of it and not using it either to interact or to play with it as a toy. And then she kind of uses in a way the examiner, like she doesn't really interact with the examiner, she's just sort of touching her to get the toy. So instead of looking at her or playing with her. And then the examiner, so that's, I think, was a very concerning thing to us when she was spending so much time looking at the frog. And again, you know, a little kid, you can imagine that she's not sort of fussing or making, oh, this is kind of, so then now the examiner's trying to get a social interaction going with her. And she just doesn't do the give and take with the ball. So, doesn't look at the examiner, and the examiner's really fun. So this is kind of where we were with her. So this was a little girl who could go on to develop autism. And you can see how the subtle early signs kind of develop a little more clearly. But even at 24 months, it's not, I mean, we have to kind of readjust what we think of as autism for those of us who, you know, kind of grew up with a little bit older kids, diagnosing them. 24-month-olds look a little different. It's a little more subtle, but still something that I think we can agree does, oh shoot, it's like, okay, does become clear. So we are now doing a study, we're done with almost our 5th year, to investigate both early risk markers and of autism and developmental characteristics in these infants who have high genetic risk for autism due to having an older SIB, and compare those kids with kids who have low genetic risk who have an older SIB that's typically developing. And we're starting at 6 months of age, looking at behavioral risk, cognitive development, and adaptive functioning. These kids are also undergoing, oh, okay, I'll tell you my hypothesis first. Infants who, what we think, or what we thought before we did the study, was that infants who developed symptoms at 24 months would demonstrate different kind of developmental trajectories compared with infants with either lower levels of symptoms at 24 months or typical development. And what we really thought was that at 6 months of age, we would not be able to see in any of our measures behavioral or brain differences. So we designed this study in order, and I should say, you know, that Joe Piven and others designed the study, and I was lucky enough to come on after that. But the study was designed to assess kids before autism started. That was the idea. And that the idea then was that these brain and behavioral differences would emerge sometime late in the first year of life, around 12 months of age, and then get clearer over time. So that was the idea. And the network that I've been referring to is headed by Joe Piven at UNC. There's 4 sites that are clinical sites that assess and recruit the infants. There's at the University of Washington, that's Steve Dager, and I at University of North Carolina, Heather Hazlitt. WashU is Kelly Bodden, and UPenn is Bob Schultz. And then there's 3 kind of cores. These are in order to deal with all the brain imaging data, they need an image analysis core that's, Garrick at University of Utah. There needs to be a data coordinating center for the imaging data and for the behavioral data, and that's at Montreal Neurological Institute of Montreal. And then the behavioral assessment core, that's my job, and what I do is make sure that all the different clinical sites are collecting data in the same way so that we can compare the data at the end of the study. And so what we're hoping to do, and we're very close to this, is recruit 400 high-risk infants. And so these are all infants with older SIMs with autism. That 100 of these infants at each of the clinical sites will enter the study at 6 months of age. And at the end of the study, based on our estimates, about 60 infants will end up with autism. And then we also have a sample of low-risk infants that have typically developing older SIMs. So the research design is we do extensive screening and then behavioral evaluation and MRI. And the MRIs, by the way, are all done with the infants sleeping. So we don't use any kind of sedatives or anything to keep the babies asleep. So this is hours and hours of rocking the baby with the scanner and putting the baby to sleep and then putting them in the scanner, and they usually sleep like babies, so it works. But we do have to wait them out. So we're seeing them at 6 months during the behavioral evaluation and MRI. 12 months, 18 months, we don't do the MRI or see them in person, but we check in. 24 months, and then at 36 months, we're kind of doing the final diagnostic assessment. And the measures I shouldn't spend too much time on, but we are looking at cognitive development. So this is kind of like a baby IQ test. It's not really IQ, but it's looking at how a baby's developing in terms of their thinking skills. So that's nonverbal kind of problem solving. It's expressive language, receptive language, fine motor, which is using your fingers and hands, and gross motor, so the rest of your body. And then adaptive functioning is what we assess by having the parents tell us how the babies are doing in the community, in their homes, in terms of these kind of similar domains. So how do they socially interact? How do they communicate? How are they doing in terms of, feeding and as they get older, dressing and other daily living skills, and how's their motor development. And then we also look for early behavioral signs of autism. And this is using the AOC, which was developed by the Canadian Consortium, who's also doing infant sleep research, and Lonnie Zwegenbaum's group developed it. And this measure, you kind of actually, the peekaboo part that you saw with Kasmina, that is actually from the AOC. And so these are 16 items designed to kind of elicit different types of social communication and repetitive behavior. Includes orienting to their name, imitation, if the baby can disengage their attention, that kind of thing. And then in the end, you get a score. And a higher score means more symptoms. And then finally, at 24 months, we assessed all the babies using the ADOS, which is a semi-standardized play-based measure to assess the level of autism symptoms that a child is showing. And I won't get into that, but in the end, it yields 3 different categories you can see at the bottom. So the highest level of symptoms is a category that is called autism. There's a moderate level of symptoms, Autism Spectrum, and then below a certain threshold, people are considered having no ASD. So what we found was very surprising, I will tell you. Our hypotheses were not supported. And I think I've already described our inclusion and exclusion criteria. So what we ended up with was 35 infants who had typically developing older SIMs, called as the low-risk infants, and then 113 high-risk infants. The gender distribution was comparable between the groups, so the same kind of proportion of females to males. The age at visit 1, so when they were supposed to be 6 months, the low-risk infants were a little bit older. On average, they were 7 months. But again, that's a pretty tight window. We're pretty proud of that. The high-risk infants were a couple months or a couple weeks younger, and that was statistically significant, but again, not that big of a difference. And by visit 2, which is at 12 months of age, they were comparable age, those two groups. And here's the first finding from this study. So at 24 months, these babies who we saw longitudinally sort of separated into these 4 groups this way. So we had, of the high-risk infants, that 113 I told you about, 18 of them ended up in the autism range. And what we called this group was ASD positive. So these kids had a really high level of autism symptoms. 14 of the babies ended up in the autism spectrum group. So this is a moderately high level of symptoms. And then 81 of the 113 ended up below the threshold. So they were considered ASD negative. And then of the low-risk infants, 35 were below the cutoff. 5 of them were above the cutoff. So they weren't involved in this study, but we're certainly going to be looking more carefully at that later. And so here's what we found that did not match our hypothesis. What we found, so the red is the autism, the kids who go on to develop autism. This is the brown color is the autism spectrum group. The green color is the high risk negative, and the blue color is the low risk negative. And this is the cognitive test score on the Mullen, so how they're doing with their thinking skills. And what you can see is that already at 6 months of age, the children who go on to develop autism are scoring lower on this Mullen. And they continue to score lower at 12 months, and then of course at 24 months. And the higher spectrum aren't really that different from the other kids until 24 months. Something happens between 12 and 24 months. So here's the statistics that kind of back up what you saw there on the graph. That there are differences overall between the groups, and that the high-risk autism group is statistically different from each of the other 3 groups at each of those at 6 months. And at 12 months, that's even more true. And then, let's see, I won't go into that here. So adaptive functioning, this is the parent report of communication, social interaction, daily living skills, and motor, sort of all combined. And this is the parent report. And you can see the exact same thing here. So at 6 months of age, the kids who go on to develop autism are in red. They have lower adaptive functioning starting at 6 months. The spectrum group, it kind of all over the place a little bit, but again, a little bit, developing a little bit better. The kids that go on to have typical development, both in the low risk and high risk group, are right around 100, and that is average, sort of age appropriate. So, and again, the statistics, for those of you who want to see this, I'm happy to go back, but this kind of just shows what you just saw is really true. And then here's the autism early signs, and just, again, higher levels of early signs are worse. So the kids that went on to develop autism, this is only at 6 and 12 months, we don't do the AOC at 24 months. But you can see the autism group has the highest number of signs, followed by the other groups. Now this was a little bit less different. At 12 months they're really different. At 6 months they're not quite as different. And you can see here from the statistics that the group who goes on to develop autism is not statistically different from the high-risk spectrum group, but they are statistically different from the high-risk negative and the low-risk negative. And then at 12 months, the autism group is different from everybody. So just if you see that again, maybe that will make more sense. Okay. So in summary, our longitudinal developmental trajectories of the high-risk infants who go on to meet criteria for autism at 24 months do differ from the high-risk infants who don't. But these differences start as early as 6 months of age, and it's across all the domains. And these differences at 6 months were unexpected. Like you said, Joe Piven and others who designed the study, the 6 month time point was designed to be before the autism signs were present. So this is a really important finding, and I think is one of the first and probably most compelling stories along these lines so far, at least in the literature that I've read. And what we think we're seeing here is a prodromal kind of general developmental differences that might already be present at 6 months. So it's not that it's not that, as you can see from the video, it's not like you would look at this little baby and think, oh, for sure she has autism right now. But what you look at is, you know, gosh, she's not quite as interactive, she's not quite as verbal, her motor development isn't quite where you'd want it. And then it kind of continues at 12 months, maybe even getting a little more concerning, and then, you know, gets more and more clear over time. But statistically speaking, we can see this. And the interesting thing about this study design is that even though the parents, for example, and even the examiners knew who was high risk and low risk, nobody knew at 6 months who was going to go on to develop autism at 24 months. So one of the critiques you could make of a lot of studies, well, you're not blind to high risk, low risk status. Well, that's true, but this can't be due to bias within the high risk group because nobody knew who was going to be in those groups. And that's something that I think made us believe the results more, because believe me, it was not, the reason we haven't published the paper yet was that people didn't believe me when I first started telling them what we were finding. And we had to really, you know, in a good way, convince everybody on the network that yes, indeed, these were real findings. The other thing that really, I think, sealed the deal in terms of people believing me was that there's now been published from our same network brain data that also completely proved us wrong in terms of findings at 6 months. So this is a picture, a very pretty picture that represents some of our brain imaging finding at 6 months. And what this is something called DTI, or diffusion tensor imaging, allows us to see how water molecules sort of move through the brain tissue. And what that shows us is something called myelination, and what myelination is about, we think, is connections between different parts of the brain. So it's like the cabling that binds together different parts of the brain. And what this paper that's now in press in American Journal of Psychiatry showed, this is from the same babies that I was talking about behaviorally, that this shows that babies who go on to develop autism have different kind of brain connections as early as 6 months of age compared to the babies who don't go on to develop autism. And these differences persist, and it's a very dynamic, changeable kind of picture which I won't get into. Actually, I am happy to if people want to talk to me afterwards, but I think essentially what this take-home message here is that the brain differences are also detectable at 6 months of age. So what this shows us is that we need earlier studies if we want to actually do what we set out to do, which is to study babies before they show signs of autism. So we are actually, we put in a new grant to renew this, and we are going to be able to see these babies, or a new set of babies for 5 more years. We're going to be doing this study and see babies starting at 3 months of age. And we're going to be using measures that 3-month-olds can do, which are going to be really interesting for us. So things like eye tracking and maybe ERP, kind of things that, as well as some behavioral measures. So really what we're doing here is we're trying to connect science and practice. And what we need is a more accurate risk profile. So if you think about, if you were a parent and you had a child with autism and you had a little baby that was about to be born, all we can tell parents right now is that their baby has a 20% chance, well, babies in the general population have a 20% chance of developing autism, but we don't know what their particular baby will end up facing in their life. You know, what we can hope for is something better than that. What we can hope for is being able to use some of these brain imaging findings and some very early behavioral findings to start telling parents earlier, it looks like your baby's on track, you don't have to worry, or, you know, I think we should start to think about early intervention. But in order to do that, we need to have monitoring available to people. So we need to have really good, I would say, easily accessible and not overly expensive healthcare for people to be able to have little baby checks that include some of these measures. And then when we start finding babies at risk, we really need to have something to offer people in terms of early intervention. And so this, I do feel, is a race that it's not clear. You know, we don't want to leave people in the lurch, right? So we don't want to have people who know their babies are at risk because we did all this fabulous research and then have no intervention for them. So I'll just take the last couple minutes to say that we're now doing a number of studies on very early intervention. We just were lucky enough, I was just lucky enough to get funded to do a study of parent-delivered intervention. So we're trying to enhance the effectiveness of parents delivering intervention for very young children with autism. These are little kids aged 12 to 24 months. And we want to work with parents to see if they can enhance their own ability to kind of be therapists to their kids. And we're doing this in collaboration with Sally Rogers and colleagues at the Mind Institute. And yeah, so if you know of anybody, we're about to launch that study. We're also currently doing, and we hope to continue doing, intensive in-home intervention studies. So this is a study that includes a team of therapists as well as parents. So joining with the parents to provide 2 years of intensive intervention to very young children with autism. And we're completing right now a multi-site intervention study of the Early Start Denver model, which works with really young kids. So all of this, is possible because of our funding agencies, so the NIH, Autism Speaks, and the Simons Foundation, as well as, of course, the families. So I just want to shout out to the families, because if you can imagine, especially being in the brain imaging study, these are families with older kids with autism who are coming with their babies to do extensive behavioral as well as imaging studies, staying up all half the night with our very friendly but tiring team of researchers. So I think it just wouldn't be possible without our incredible community here. So I think that's all I have to say, and yeah, happy to take questions.
What do you think are some short-term clinical outcomes that you might be able to apply? I mean, you can tell parents about this, that there are early signs, but parents are probably banging at the doors.
So what are some short-term outcomes? So for example, what might we be able to find from this imaging study that could help parents in the near term? Well, it is sort of a labor of love for these parents, because they do get out of it directly our developmental assessments. So we are able to tell parents how their child is developing. But the MRI, for example, is so sort of cutting edge and new that then we really don't know the clinical utility of it yet. So even though, a lot of these findings are statistically interesting and might lead us to be able to develop better tests, at this point, if you remember, and I shouldn't have done this, I shouldn't have ended, but some of this, even though you can see in the graphs that the kids who went on to develop autism have lower development, really their standardized scores are like 85 or 90, the average. So a lot of those kids are going to be in the average range. So it's not like the Vineland or the Mullen is going to necessarily identify specific kids. So it's at this point we don't know yet. We have to still do research to find out. But that's the hope, is that we'll find things out that will help parents.
And what are the ages you're looking for that early start? Are you still recruiting?
We're not for the early start, although we probably will be again. But the PATH study is 12 to 24-month-olds, and we're still. There's 2 studies. One is the imaging study, and that is anyone with an older sibling with autism and a baby can be in the study. And their baby has to be under 12 months of age. We hope that they're under 6 months, but we'll still enter people a little later. For the PATH study, which is our new treatment study, they're going to be kids between 12 and 24 months.
And you don't have to have a sibling?
No sibling necessary, yeah. Yeah.
Could you elaborate a little bit on the DTI imaging that you said?
I would skip over to. Let me break that again. So the DTI, let me elaborate on that. So what we do, we as a very broad term here. I'm a psychologist, and this is a very multidisciplinary team. So what they do is they take a measure. It's called fractional anisotropy, which is a very fancy way of looking at this water molecule movement. Anyway, they look at that, and what happened at 6 months is the kids that went on to develop autism had higher fractional anisotropy than the kids who didn't. And that was, usually we think of higher as better in this case. But then what happened is at 12 months, if you can imagine like a graph that crosses, the fractional anisotropy went way down. At 12 months, the group that didn't have autism was going up. And so by 24 months, if I'm sort of doing this with my hands, by 24 months, the kids who had autism had lower fractional anisotropy, and the kids who had not autism had higher. So it's really an interesting story to me because, first of all, it says you have to have longitudinal studies. Because if we just looked at them at 12 months, we might have said, oh, there's no difference and DTI doesn't tell us anything. But by looking over time, what we found was that there was this really dynamic change that started, different, crossed over, and then, we still haven't followed up. And we need to add more kids, et cetera, et cetera. But, I think what it shows is that this is, again, really complicated, and we don't yet even know how, it was 13 out of 15 fiber tracts that showed this pattern. And so it was around the whole brain, so it wasn't just one part of the brain, it was really diffuse. So we don't know why. I don't yet, no one has yet described to me what FA is in a way that a psychologist can understand it. Really, that makes sense to me. In terms of, I want to know, well, what does that mean? Like, what's going on? And that's where things get a little murky. So I guess there's still research to do. One of the colleague, Steve Dager, who I work with, does something called MRSI, so it's spectroscopic imaging, and that actually looks at brain chemistry. And I would say that gets a little bit closer to understanding some of the whys. So looking at what are some of these chemicals in the brain that might be different. Maybe that will help us understand more what's going on.
In the PATH program, when you do the interventions with the parents, is it mostly ABA?
No, it's ABA inspired, but it's very much, it's the early start Denver model is the model that we're using, and this is the parent delivered kind of approach. And so what ESDM does, this approach, is it kind of is it merges ABA and developmental approaches. So it looks really different than ABA because you're following a child's lead, you're interacting directly with children in a very child-friendly way, and yet you're taking data really carefully, you're thinking very much about what the child's developmental needs are, and you're teaching those things in a systematic way. It just doesn't look like that. So it's a very much hybrid, I would say, of those two approaches. And so, the parent-delivered intervention piece it's really, well, I could talk again forever about that, but one of the things that we were really hoping is that parent-delivered intervention for autism would be effective because little kids, if we're starting to identify babies, typically babies don't go to school, they don't go to a therapist's office, they are really interacting with a very small number of caregivers, typically. Anyway, I know babies go to, daycare and all, but basically the way babies learn is from one person. And so we were thinking this would be great, especially, under-resourced communities don't have access to evidence-based intervention. If we could teach parents, that would be great. It really matches, the kind of early intervention models that Birth to Threes use. That would be great. But the problem is, so now there's been all these single study designs that have shown, oh yeah, this is going to work. And then just in the last several years, Autism Speaks and other organizations funded randomized clinical trials, which are kind of the final way to show that something is really working. None of them worked. So 4 or 5 now, including our own, did not show effects on child outcomes compared to community intervention as usual. So now we're kind of going back and saying, what happened? because we know that ESDM is effective when it's, done by interventionists, and we know that parents can learn it because we've done those single subject studies. So what's going on? And that's kind of what our next set of studies are trying to get at. So is there something about our teaching that wasn't effective? We know how to teach little babies, but we're not as good with adult learners. So we had to kind of go back to the literature and say, how do adults learn? What's the science of adult behavior change? Because that's what we're kind of asking parents to do. We also have to think about a number of other things, like whether parents just need more support to do that kind of thing, in addition to parenting, in addition to working, in addition to all the other things parents do. So perhaps, that's just not going to be a standalone solution for many parents. And maybe, there's lots of things that we're thinking about, but we're still trying, because I think there are so many communities that just don't have access to evidence-based intervention. So we really can't give up on developing that, but I wouldn't say we've solved the problem yet. Yeah.
That sort of taps into a question I had. To me, there was a real difference in the way Mom presented when she came in with the baby at that initial appointment, and then when we saw her, to me she seemed a bit more flat, a bit more depressed. It was just an off day for her, but I was wondering if, potentially there's a parent confound, thinking that parents become more aware that maybe their child is developing differently. I think this child had an older sibling with autism. I'm just thinking of the sort of risk factors in the families, and maybe this is part of what is playing into why services are being delivered.
It can for some things. I mean, one of the things I think that we know, so we know a couple things. One thing we know is that we've looked for differences in parenting when you look at parents of kids with autism and parents of other kids, and you can't really find it. So it's not that parents of kids with autism in general aren't as good as parents. And if anything, I think they might be better parents in a sense, or at least better at some of this stuff, because especially if they have an older sibling with autism, a lot of parents become, super experts at all of this kind of thing. What I've noticed is just the big variety of, I think that we need to have huge studies if we're going to look at this scientifically, because there are some parents who understandably are just devastated when their second child is, every parent is deeply affected, but some parents really do get depressed or really do develop, serious psychiatric kind of reaction to this news. Other parents get in the saddle and say, I am going, they get activated, they get really effective, and they become super parents. Other parents maybe don't want to know, and for a long time are in kind of what we would call denial, I guess. For lack of a better word, but just sort of like, I think my child's going to grow out of it. I don't want to do anything yet. Not consciously, of course, but there's just such a huge range of reactions, and that's another thing that we're trying to get better at, is individualizing our treatments to all the different parents that are, bringing so many different needs to the situation. Some parents have incredible support systems. Some parents are single parents without any support system, and so you can't really have a one-size-fits-all. But I do think, I don't know that this one, you can't really take just a single video, but I think it's a great thought that the videos to think about that more. Questions? Yeah.
Are there any relationships with public schools with these programs?
Well, no, not at the moment. I would love there to be. We have, I think our probably best, source of referrals was our local birth to 3 providers for the first intervention study. So that, I hope will continue. And I would really love to do more of that. So it's really more the birth to 3 programs that are, the established programs that we would interact with. But yeah, I can imagine, a system where there was sort of specialized clinics that were providing this kind of monitoring, that were providing specialized intervention, that were in partnership with, the more broad developmental programs that are available to people. Because no one program can do it all. And I don't think we would expect that, but at the same time, if we start to figure out that these programs can really be helpful, we want them to be available. So I could really imagine some wonderful collaborations that could come out of this. Well, it is 8:10. Is everyone sleepy and ready to go? I'm happy to take questions afterwards, but thank you so much for coming.